turn our attention to a very serious discussion, and I really want people to pay attention because we're now met with an increase in a number of sexually transmitted diseases. Would you imagine that they're back? And so the hospital is dealing with it. Our medical professionals on Island are dealing with it, and we're happy to be joined this morning by Dr. the Most Honorable Corey Forde, who is the Director of Clinical and Diagnostic Services at the Queen Elizabeth Hospital. Dr. Forde, good morning to you.
Good morning to you.
What are you seeing?
Okay.
Just say it plainly so everybody gets it.
I'm going to say it plainly. I think, I just want to say that there's a definite trend, not only in Barbados, but globally, and I really want to speak from that bridge to increasing cases globally, certainly of things like syphilis. And then obviously there are concerns about things such as gonorrhea, chlamydia, which I think should take a little bit more precedence in talk. And I think once you see those particular illnesses presented themselves, that's usually followed, of course, by HIV, because the obvious risk of exposure is increased. And obviously, I believe it's really a result of sometimes people's sexual practices, sometimes promiscuity. And I think that's something that we need to rein in, certainly as a community, and remind people that these diseases still exist, and HIV still exists, chlamydia and gonorrhea still exists. And also I want to take the opportunity as well to really not only tell people that, but to always encourage people to get tested. If you're changing your partner from one partner to the next, there's nothing wrong with getting tested. If you know wrongfully that you may be having multiple partners, it's okay to be tested. And not only, I think we have this thing in our head, it's only, the younger age group, but this is at many age groups, different levels. From my perspective, I have a little bit more concern. I'll probably talk about that a little bit later, certainly about syphilis and its presentation. From our medical training, they always tell us syphilis is the great mimicker. So it can look like many different things, but it's important, obviously, to get tested for these things if you know that your sexual practices are not the same. It's not something that people want to wake up to be hearing me speaking about in the morning. But I think it's important to remain educated on these aspects. What I always tell people is my grandfather told me back in the days was knowledge is power. And if people know and understand and able to identify the diseases and these sexually transmitted diseases and the challenges that they bring, then they're better able to make educated decisions. And certainly that's why I'm here today. I'm not here to really talk increase in this or increase in that. It's more to educate people about their sexual practices, what they should do, what they shouldn't do, and those particular aspects.
A lot of times you get the diagnosis and you ask, well, how did I get this? Yeah. And it starts not necessarily with the act. It starts with a decision. Yes. And so we lose our ability to make informed decisions because we become comfortable. Mm-hmm. And we assume that all things will play out the way that they've always played out. Yeah. And it's simply sometimes because we have not been talking about this a lot. We assume all is well. Yeah. And the reality is, as we've met now, is globally, we're seeing a surge, a rise in the number of cases of people who are having these sexually transmitted diseases. Yes. Yes. What do we now need to do as a community, not to fix it, because we want to be able to get to that eventually, to begin to reorganize our thoughts about taking greater responsibility before we take action?
I love how you said it. And it's about taking responsibility, certainly, for our actions. I think one of the first things we do as a society and as a community in dealing with aspects like this is to get tested. If you know that you have more than one partner, like I said before, if you're probably at risk, you get tested. But I think the other responsible thing, which people miss sometimes, is if you were given a diagnosis, for example, things which are treatable, right? So gonorrhea, chlamydia, or even syphilis, definitely treatable diseases, or even if you're diagnosed with HIV, to make sure you tell your partner. Also, not only for you to get tested, but to ensure that all the people that you interact with certainly also get tested as well. And I think that needs to be a major driver, because sometimes people go to the doctor, a diagnosis is made, they get treated and they feel good and they go back. You know what? Diseases such as chlamydia, gonorrhea, and syphilis, you're going to get them all back again if you continue to interact with that partner. So being treated doesn't mean, that's another important point, does not necessarily mean that you can't get that particular infection again for the ones which are definitely treatable. And I think the long-term aspect of this is important. So we don't often see them come to the hospital. We will see them come to the hospital if they get the complications of the disease. So those are the untreated people.
Because we continue our conversation with the most honorable Dr. Corey Forde, who is himself the Director of Clinical and Diagnostic Services with the Queen Elizabeth Hospital, as we look at the rise in some infectious and sexually transmitted diseases in the region. And of course, when we ended, we want to look at how do we spot the symptoms, because some of them are not easily detectable. Let's break that down, Dr. Forde.
Yeah, so I'll break it down, make it really simple, not complex for the public. So I just want to start off by talking about chlamydia and gonorrhea, which can actually be, especially chlamydia, can be asymptomatic. So, and that's challenging because although it's asymptomatic, meaning you don't exhibit any symptoms, you can still spread the illness. But of course, I need you to put chlamydia and gonorrhea together, because usually if we treat one, we treat the other, because they kind of like travel almost together. So they can present, of course, with people already know, problems with urination, burning or urination. For example, if it's affected rectally, you can get rectal bleeding. In females, it can affect the female genital tract, and they can get discharge, etc. But people say, okay, so they're treatable, so what's the big deal? Go at any point and get treated. But you can get complications long-term, certainly from them. So in females, it can get what we call chronic inflammatory disease of the pelvis, which is a challenge in terms of childbearing and the childbearing age, which a lot of people, 15 to 24, 25-year age group, or that's where that would be a big challenge in terms of childbearing age group. And then things such as, for example, chlamydia, for example, can prevent with things like joint pains, and those sort of aspects. And the males affect the actual male genital organs. In very rare cases, it can cause infertility in males, a little bit more, probably more common in females. I really want to talk more about syphilis, because I think this is really a global challenge. But before I move on from that, I just want to mention one more key point, and that the treatment which is available, there's a lot of resistance globally, and one of the challenges that I have in the infectious disease world in managing cases of gonorrhea. And certainly we see a lot of that in Asia, in Europe, and of course, I'm sure not too long from now, we'll see an expansion of that certainly in the region. As I said before, I want to talk a little about syphilis, because syphilis is a bit different, and one that I think is the great mimicker. So the physicians have to be very alert and be very apt at deciding when to test for this one. So syphilis, after you come in contact with that individual, you can get this little, I would call it for simplicity, a little bump. And it may be on the genitalia, maybe in the mouth, wherever the inoculum is, I tell people. So it's not only, on genitalia, it can be rectally, it can be internal, and the problem with it is it's not painful. So for people, if it's not painful, it's not a problem.
Correct.
And so it can go on. That's the first kind of like phase of the disease, and then it disappears after a few weeks, like up to about 6 weeks, can disappear, and then the other phase comes. So that can be with normal things. It looks like anything. So you can get lots of lymph nodes. People can get partial hair loss. You can get headaches. That sounds like anything. You can get headaches. But another common thing at that phase, you can get lesions in the palms of the hands and the soles of the feet. That's the more obvious one that was sent to the doctor. But remember, I just mentioned that the other things can happen, which look like a flu. You can get a bit of throat problems, etc., or sore throat. So it looks like that. But the problem with being untreated is not only you can infect people, but you can move into the other phase where it's latent. So those first two phases of the disease really are the phases where you can really infect people, like greater. So when you move into the latent phase, the disease is still there. You can still transmit the disease, a little bit less so, but that's where the trouble is brewing, because now you can attack your organs, your cardiovascular system, causing problems with the heart valve, or even the big vessels within the body. It can also affect the brain. So you see people, when we evaluate people for dementia, we often check for syphilis, because it's one of the fall-offs long term of that. It can affect the brain and the lining of the brain, as well as the common, and the nervous system, which is a big one, which it can affect and people chronically. So those are the things, and even if you treat it then, those things are there, they're not going to go away. So we want to try to prevent people from getting to that phase. I think that the thing about syphilis for me is if you were tested for syphilis and you're positive, it's important as well that the physician gets the treatment right and timely. You know, you don't want to develop this, but you don't also spread the illness as well within the community. And then briefly about HIV, and you know, there's treatment. So people, I always want to tell people, you know, and encourage people to get tested, not necessarily because you know, the HIV, you know, will hurt them or kill them in the end, because we have brilliant drugs which people can live a normal life, normal life expectancy. It's about transmission to other individuals, but it's also the later you present yourself to be tested, if you may think you may have been exposed or you're in a high-risk group. The problem at that particular phase becomes that the later you present, the greater risk of your immune system getting so low that you get one of these bad infections, and then it becomes very, very difficult. That is one of the reasons I wanted to really encourage people to get tested, certainly for HIV, but all of these sexually transmitted diseases. Because if you can catch it early, you can kind of like deal with it and live a lifelong productive life. If you present later, you present with all the different things that can happen, whether it be infection in the brain, which is common, a severe infection in the lung, you end up in the hospital. What I'm really trying to prevent today is people presenting to our system at the hospital level with AIDS, right? With the complications associated with that, which is something that as a country that, you know, as having a very strong HIV program in the region, you know, one of the things you want to do is to catch people early to prevent them from, you know, descending and presenting late with AIDS in the background. Of course, that's treatable, but there are obviously complications here.
And you're quite right. We don't attend the doctor until there's pain. Pain is the first indicator. Or we don't like the way this feels. And so therefore, we're saying to folks watching today, get ahead of it. The minute you know that you're engaging in what could be a little bit risky behavior, start your testing. Before you even start your testing so you know your status. And in know your status, then you're far more empowered to make more informed decisions. But then sometimes we fool ourselves into thinking, but that's what penicillin was developed for. Was it developed to take care of all of these kinds of things? But you're saying now that you're noticing that the responses to a lot of these traditional treatments, that response in the body is changing.
It's a global challenge. It's a global challenge, and it's certainly increasing. I mentioned specifically gonorrhea. So some of the drugs that we used before, you have to use higher concentrations, or you have to have repeated treatments, etc., especially for that particular part. And then the problem I have, obviously, or see out there is that people come, they get a problem, they get tested, they get treated, and they feel good, and they go straight back into the person, and the person that they're involved are persons, you know, are still infected, so they get reinfected again. There are lots of cases I had where people, you know, have been reinfected. Although you tell them to get their partners treated, they'll tell you the partners are treated, but you know, you don't have the proof. So the proof is in the pudding. I just want to encourage people to go out there, get tested, know your status, right? I think that's important. The earlier you know, the better off we can help you. And I think that's something that needs to be driven. And of course, you get to protect the people around you. But also, especially in females, it's also important because if you're having sexual activities, it's unprotected. I always tell people when I ask them, do you have unprotected? And of course, they say, most of the time, I use protection. Like most of the time equals a problem. So you can get pregnant, right? And then you have to think about another consequence of that. So some of these illnesses can also affect kids as they pass through the birth canal and being born, if you know, they don't know the status. Again, all I can do is to ask people, you know, to use reason. And I always say the reason I'm here is not for any alarm or anything. The reason I'm here is to tell people that knowledge is power. And if you have knowledge of something, then you're able to act on it more efficiently, effectively, for improved outcomes within your individual self.
You're quite right. How many more times must we hear one person say it only happened that one time, and that one time you were caught? So sometimes, not sometimes, every time you need to be protected. Indeed, you can't underscore that enough. That decision for you to use no protection is that relationship discussion you have with your partner. That's between the two of you. But apart from that, protection is your best prevention sometimes as well. But abstinence also works in my book. And certainly we want you to not have to, don't put that aside. Briefly, I want to look at the mpox and where we are now with that.
Right. So really, honestly, I've just seen, just like the rest of the public, the cases which were mentioned. I know people see the pictures, so people often get afraid because they see the lots of bumps all over and people get afraid. What I would say is, I mean, to be honest with you, when it comes to monkeypox, the transmission is a bit difficult for transmission, obviously related to sexual practices, etc. Contact with the various items. That's something that's not just going to happen and spread like wildfire. If it did, it would have spread across the globe, much more significantly. And most of persons who are monkeypox need to mention this to the public so they understand. So knowledge is power. Most people who are infected with monkeypox, they don't go to hospital, don't have to be admitted to hospital. People don't know that. The challenge with monkeypox, certainly with the different clades that you see in Africa, was really the effect it had on kids and deaths in kids. That was really one of the biggest challenges over there for many, 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 many years. But in terms of monkeypox, you stay at home, you stay on isolation for about 21 days or so, as the lesions go down, and that's it. If they do get complications, that's the only way they'll get into hospital. If they get secondary skin infections or bacterial infections, which are in the background of that, then certainly. But I think people see the pictures, they get all anxious about them. But
it ain't pretty.
They're not pretty. We get anxious about them too, but in understanding the disease, the disease trajectory is really about protecting public. And everything goes back to responsibility, being responsible citizens, being responsible people, educate your people. A few weeks ago, a church called me in to talk with STDs. I was very impressed by that. Seventh-day Adventist group called me in to talk, and I was very impressed by the openness to hear these things, because in churches, even in that community, it's just a part of the larger community. So those are things I really want to impress in people. Don't be afraid to talk about these things. Continue to educate the public. Like I said, knowledge is power, and we can get past most of these events once we do the right thing, and understanding that society has changed, as we've been discussing previously, over the years. So people's thoughts, practices, behaviors are often a bit different. And I think because we have now really good treatments for stuff, people are a little bit more callous. People ask me about things such as PrEP, and when they will use it, etc. So those are all questions that are out there, and I think we need to continue to educate our public about these aspects so that we improve throughout. And I just want to stress the point this morning that it's not even about increasing in cases. People get stuck on that. It's about ensuring that we don't get to a point where we have a bigger challenge.
Right. And it becomes unmanageable.
Yeah.
Thank you so much, Dr. The Most Honorable Corey Forde, at the phone rang at the right time. Thank you so much for joining us this morning, and we wish you well. Thank you so much.
Thank you.
You're welcome.
Morning, morning, morning. Good morning.